Preventative measures. Face masks, hygiene, and precautions. If you are traveling to any of these affected regions, then it is important to do whatever you can to protect yourself. The best preventative measures and precautions fall into a few categories. These are: hygiene, useful tools, general health. Hygiene tips. The first and most important measure to take to reduce the likelihood of contracting novel coronavirus is to simply practice the best hygiene possible. That means you should always wash your hands before touching your face, wash your food thoroughly before eating, avoid touching other surfaces. The other tip is to avoid spaces where the illness is likely to travel rapidly. A good example of this would be a crowded train or elevator. Here, you will be near many other people that could be carrying the disease, in a contained environment. This makes it potentially very easy for the virus to spread via airborne droplets. Where possible, avoid densely crowded areas that are sealed closed. Wearing gloves may also help to prevent the spread of illness to some degree, as it prevents the virus from landing on your skin and then being transferred to the face that way. Be careful about the food you eat, and for preference choose to buy sealed food items from larger stores. Useful tools. Another consideration is the role of a face mask. This is a breathing mask that you wear over the mouth and the nose to filter air and thereby prevent the spread of disease. These masks serve two purposes: not only do they prevent the wearer from contracting the virus, but they also help to prevent them from spreading it. This works because the mask contains the droplets that they may propel when sneezing or coughing. So do they work? The good news is that they do appear to be effective based on studies. In one study, it was found that those who used the masks correctly were 80% less likely to contract flu. Seeing as the coronavirus appears to travel in the same manner as the flu, this makes it likely that the mask would prove similarly beneficial. This, of course, works by preventing the droplets of moisture from reaching your mouth or nose where they could cause an infection. Because they are not airtight, for obvious reasons, this will not have a 100% success rate but should be effective enough to make a significant improvement. Likewise, wearing shades could even be useful, seeing as contact with the eyes can also lead to the condition spreading. Vitamins, minerals, and how to improve your immunity. While there is no vaccination against coronavirus, generally improving your health and immunity is a way to protect against all diseases. Have you ever had the flu and noticed that your wife and children usually get it too? But now and then, one of you manages to coast through completely fine. This is because that person has a stronger immune system at that time, or they have encountered that specific mutation of the virus before. This is what we ideally want to try and emulate when traveling and when being exposed to the virus, and so with that in mind, here are some ways to keep yourself safe and healthy. Nutrition. The first and most important thing you can do is to make sure you are eating a balanced and nutritious diet. Avoid empty calories that don't provide any vitamins and minerals, and instead try to get as much colorful fruit and vegetables on your plate as possible. The most important nutrients to seek out in particular include vitamin C, a powerful antioxidant that is known to support immunity, vitamin A, vitamin E, and selenium. Selenium is useful for preventing the overactivity of the immune system, which can lead to inflammation and other similar issues. Antioxidants are substances that combat the action of free radicals in the body, and these can otherwise damage cells and tax the immunity. It's also important to eat plenty of fiber, fermented foods, and yogurts. These contain live cultures of healthy bacteria that help to strengthen the body's immunity. That's because friendly bacteria in the stomach and gut can help to destroy harmful bacteria that otherwise wreak havoc on the immune system. Getting a wide variety of different natural foods is the very best thing you can do for a healthy microbiome. Lifestyle factors. Another thing to consider is the importance of spending time outside. Sunlight encourages the body to produce vitamin D, which has recently been shown by studies to be more important than vitamin C for strengthening immunity. Fresh air and cold exposure is also beneficial. Not only does fresh air help to clear out the lungs, but being cold can help to train the immune system so that it is capable of working harder and doing its job better. Other things can also affect your immunity. Did you know, for example, that flossing your teeth can make you less likely to contract a wide range of illnesses? This is because our mouths are constantly bombarded by bacteria, which leaves us susceptible to other problems. When the mouth is clean, that problem disappears. But the most important lifestyle factors of all are to a. Avoid stress and b. Get lots of sleep. When we are stressed or sleep deprived, this causes the body to suppress immune activity, leaving us open to attack. When we are rested both mentally and physically, we go into those battles with a full tank of fuel behind us. Symptoms of coronavirus, recognizing it in yourself and others. The symptoms of coronavirus are generally very similar to the symptoms of other viruses and chest infections. This can make it particularly difficult to identify causes, and this is one of the reasons that the problem has been able to spread so quickly. Symptoms of coronavirus include coughing, a persistent and potentially painful cough that can also keep you awake at night. A sore throat, this goes hand in hand with the cough, but is also due to inflammation of the airways. Tiredness and lethargy, like most viral infections, the flu will leave you feeling tired and exhausted from small amounts of activity. This is owing to the effort your body is putting in when fighting the infection. Temperature. A temperature is your body's way of attempting to drive out invading viruses. This will cause the body to become very hot, as it tries to make the environment inhospitable. That means that the temperature in itself is not actually a negative thing, but rather an important strategy used by the body, so you should not try to fight the body by bringing the temperature back down. That said, you should monitor the temperature and make sure it doesn't get too high, which can be dangerous. Likewise, you should keep drinking lots of water, as dehydration is one of the most serious complications of a fever. Difficulty breathing. This is the most severe symptom of coronavirus. Listen for a rattling sound in the chest. Likewise, look for signs of effortful, rapid breathing. If the patient also has signs of bluing around the lips in particular, then you should seek medical attention immediately. If you notice any signs of coronavirus, then you should seriously consider whether this is the possible cause. With the symptoms being so similar to other types of cold and viruses, it can be difficult to distinguish between them. The main evidence then is situational, contextual. Have you been to any of the most affected areas in China? Have you met anyone from that region, or who has traveled to the region? Also making life more difficult is the fact that symptoms can take several days to emerge, anywhere from 2 to 10 days. You need to think back at least this far then when considering whether coronavirus is a likely candidate for your problems. Treatment and outcomes. If you notice any of the signs of coronavirus, then you must seek medical attention immediately. Again, this is not necessarily for your own sake as much as to try and control the spread of the disease and prevent it from spreading to anyone else. Many governments and health officials advise and request that patients attempt to self-quarantine. This essentially means that they should avoid going out into public spaces, and should stay home as much as possible. This also includes not visiting the doctor or hospital waiting rooms, where you can of course risk spreading the disease to others. For that reason, it's instead recommended that you call the doctor to visit you. If you are taken into the hospital, you will be placed under observation, and your breathing will be assisted should you need it. This can involve the use of a nebulizer, as well as an oxygen mask. These will help you to take more oxygen into the lungs with each breath, as well as to reduce swelling and other effects that are making it more difficult to breathe. Your temperature will also be monitored. Things you can do yourself to help ease the symptoms and provide self-care include, getting lots of rest and not pushing yourself mentally or physically, drinking lots of water. If you have a fever, then one of the most serious concerns is that this can lead to dehydration and associated problems. Manage the buildup of phlegm and mucus by using a steam inhalation. To do this, fill a bowl full of hot water and then hold your head over it with a blanket. Make sure that the steam is not hot enough to burn your nostrils, but that it is warm enough to break down the mucus. You can also try taking long hot showers. You may also need to manage some secondary symptoms that can be caused by primary symptoms. For example, you may struggle with poor sleep, or you might have headaches due to the buildup of pressure in the sinuses. To deal with these, you can use analgesics. There is no known cure for coronavirus, and as a viral infection, it cannot be treated with antibiotics. However, with that said, the condition is also self-limiting, meaning that it will disappear over time. This can take a few days to a few months, depending on the severity of the infection, the appearance of complications, the health of the patient, and the treatment given. Conclusion. Hopefully, this guide has served as a useful introduction and comprehensive overview of the coronavirus. You now know where you are likely to encounter it, just how at risk you are, and how to spot the symptoms. You understand the nature and the history of the condition, and you know how to keep yourself as safe as possible. The most important take-home from all this perhaps is that the coronavirus remains a low risk for the majority of people in the US and Europe. Even when traveling, it is highly unlikely at this stage that we would contract it. Nevertheless, it is still highly important that we are vigilant, especially as the prominence of the disease is spreading every single day. Should the illness become widespread in your region, you are now well equipped to deal with it and to understand the problem. Make sure to take every reasonable precaution, but don't lose your mind worrying about the disease. There are many more pressing concerns that most of us should be focusing on. Only one I want to say at the finish. This book was published at the beginning Wuhan crisis, when was about 3,000 viruses people, and at least 100 died. Now, when I writing these words, the world count of diseases is about 800,000 and died about 15,000. It's honorable. God bless you and your loved ones, love each other.